Welcome to the pretesting tutorial. The first machine you will do on the patient is the autorefractor. It takes an estimated prescription of the eye and also measures the curvature of the eye. Ask the patient to put their chin on the chin rest and forehead on the bar above. The motion stick moves the machine up and moves it down in order to find the patient's eye on the screen. The chin rest button also moves their chin up and down to help get their eye in the position it needs to be. Once you have their eye positioned in the center of the screen with the circle lining up, you press the button on the top of the motion stick. You then see the machine to begin to take measurements from the patient's eye. Once the measurements from the right eye are complete, the machine will automatically move over to the left eye. You may have to make adjustments to recenter the eye in the middle of the screen. The piece of paper will then print out all the measurements. The second machine you will use on the patient is to the left of the autorefracting machine. It is called the NCT, or the non-contact tonometer. It checks the pressure of the eye and also does a screening test for glaucoma. Align the patient's eye in the middle of the screen. Once you have aligned the eye, you will press the big blue button for the machine to start the test. Once the machine successfully puffs the first eye, it will automatically move over to the left eye. The final machine you will use on the patients is called the optomap. It takes a picture of the back of the eye and checks the health of the eye as well. When using this machine, you will search the patient with their account number written on the yellow form. You then click the patient's file and make sure that the doctor they are seeing that day aligns with the one on the screen, and then click Capture. While the optomap warms up, you can explain to the patients what procedure will be happening. When they look into the machine with one eye at a time, they will find a target. At first it will be blue, and they want to slowly continue to move into the machine until the target turns green. If the target turns red, that means they are too far in the machine and they need to slowly move back to achieve the green. There are two sets of handlebars that the patients can use on the side of the machine to help stabilize them. On your screen, you will be able to gauge how close and far the patient's eye is inside the machine to give them guidance. Once you see green or a double blue circle, you will click the eyeball on the screen and it will capture the picture. Once you see the picture, you will click which eye it is and then click Keep on the bottom of the screen. You will take 2 pictures on each eye.